Hello, everyone, and welcome to Public Health Spotlight, a day in the life, presented by ASPPH and Beaumont Foundation. I'm Nick Mahoney, Director of Student and Alumni Engagement for ASPPH, and we're really excited to have such an esteemed panel today talking about a day in the life and the working in public health. Throughout the presentation, you will have the ability to ask questions via the Q&A feature. Just type your questions in there, and we will save some time at the end for general question and answer. But if you have any specific questions, you can feel free to ask throughout, and our panelists will try throughout the presentation to give you written responses. And here is our esteemed panel. And our first presenter is going to be Beatrice Abiro, and we're excited to have you present on being a Senior Manager of Policy Research for Instacart. Thank you so much for presenting today.
Fantastic. Happy National Public Health Week, everyone. It's a pleasure to be here. I may need a little help with the slides just in advance, Nick. But I'm glad to be here. I am Beatrice Abiero, Senior Manager of Policy Research at Instacart. Looking forward to share about my career journey. To begin with, I do want to flex my public health roots and show you that I do have some public health background. So a little bit about me. I earned my Bachelor of Science in Public Health from the University of Arizona. And it was really in this place that I got introduced to what public health was and potentially different, and the potential career paths that could occur in public health. And while I was at the University of Arizona, I did a number of research internships and worked on research projects that inspired me to earn a dual title PhD in health policy administration and demography from Penn State. We are, from anyone who is at Penn State. And, you know, through my PhD program, where again, I participated in a number of internships and research projects and realized that, and observed a couple things. One, that research in academia is done very differently than in private sector. And I was keen on being able to utilize my research skills in private sector to inform research in a timely and relevant way that's a little bit different than in academia. And so after earning my PhD, I moved right on into the private sector, working on patient experience in the military health system, and then eventually transitioning onto Instacart. Currently, I'm a researcher and thought leader in government affairs at Instacart, and I'll talk a little bit more about what government affairs is and what being a thought leader is. And what this means is that I work at the intersection of food, policy, and tech. Feel free to post in the chat, but I'd love to know who's ever heard of Instacart, or if you've used Instacart. If you have, just type in yes into the chat. Instacart is a grocery delivery service. We became very popular during the pandemic. And it is available in North America. We have same-day delivery to 95% of households in North America and Canada. Oh, I'm seeing all these yeses. This is amazing. And we have reached for 93% of households who are in food deserts or low-income, low-access areas. The mission of Instacart is to create a world where everyone has access to the food they love and more time to enjoy it together. And I'm sure you're wondering, well, what does this have to do with public health? And it's been an amazing experience being able to be at Instacart to actually inform public health. So I'll share some specific examples. But I'm sharing this, my work at Instacart to highlight that there are opportunities in government affairs. And I said that I was going to define what government affairs is. I like to think of government affairs as the defense muscle of a company. So typically, and most government affairs teams are structured differently, but it will include lawyers, communications folks, lobbyists, and advocates, as well as researchers who are working very closely with government stakeholders and communities where their business is impacting constituents. At the same time, where the defense piece comes in is in how government affairs advises a company in responding to regulation and responding to different policy things that may be coming down the pipeline. And so being in this space with my public health background, with my policy background, I'm able to do some really cool work. And so if you've never heard of government affairs as a potential avenue for public health, consider it possible. I'm one of those people where it's possible. Nick, next slide, please. So what is my typical day? My typical day varies a lot. So it was actually very difficult for me to think of putting together a snapshot of a schedule, but I distilled my work into three key areas. So I inform work by serving as a strategy and a thought leader, meaning that I use my research skills to help Instacart think about how do we develop a plan, a game plan, and dabbling in research and working with research partners, coming up with different projects. What are the types of questions we should be asking? What's missing from the work that we've been doing? And so being able to informed strategy and thought leadership is a key part of the work that I do on a day-to-day. The second is one of my favorite things, and that is to engage with the partners themselves. So these could be external academics, nonprofit organizations, community-based organizations who are doing the work when it comes to improving food access and promoting health outcomes. And so what this looks like is engaging in meetings. There will be outreach, sometimes on our part, sometimes on their part, where folks who are interested in working with Instacart, who have been doing research within the space for years, are wondering, well, how can online grocery help solve for food access issues? And so I get an opportunity to connect directly with folks in meetings and conferences, serving on task force, attending different events in order to really spark that connection, cultivate relationships, and figure out synergies where we could work together. And then the last aspect of my work is project management. And this tends to be a bit of a catch-all. So what I consider this is the actual work, like where I'm sitting in front of my computer, either diving through data to understand what are the meaningful data points, data points that could be helpful within a given project, or how can we help a project be successful from start to finish. And this could either mean, projects from end to end where we've developed the research question, we are conducting the research study itself, and then figuring out what the meaningful insights are from that. On the right are some pictures from my day-to-day. The top left includes a picture where I presented at the Luxembourg Institute of Socioeconomic Research last spring, sharing what research in private sector can look like to an academic audience. And then the last couple pictures on the right with folks in it are at our Instacart Health launch in September of 2021 at a national partnerships for families, for women and families in DC with a good colleague. And so these represent some different events that I've been at. And then on the bottom right is the cover of our economic impact report, where I led the analytic inputs for this first time report for the company. Next slide, please. All right, so here's an example of what it looks like to engage with external research partners on food as medicine programs. Food as medicine, sometimes referred to as food is medicine, there's still lots of debate about this, is a movement in thinking about how food plays a pivotal role in nutrition and health outcomes. And so for this public health audience, it could be very obvious that food is a key social determinant of health. And Instacart thought about this and was like, had developed a lot of strategy in thinking about, well, how do we go from just being a grocery delivery company to a health enablement platform? And so in September of 2021, alongside this huge White House conference on hunger, we launched Instacart Health, which is a set of tools, products, a policy agenda, basically what we believe in terms of how Instacart can help support this movement. And so there are three key lessons that I've learned in terms of being part of this work. And as I mentioned before, that's in cultivating relationships with research partners. So I get a chance to really engage with folks who are doing the work to understand, well, how can Instacart Health help solve or support their work? The third lesson is in aligning on research objectives. In such a big field like food as medicine, there could be a number of different questions, different patient groups that we can be looking at, but how do we prioritize what's really relevant both for Instacart and for our partners. And so it's important to think about how to align on those research objectives. And then finally, how do we improve the product based on the input from our partners and the folks that we're working with? And so these have been 3 key lessons in being involved with this work. And the impact has been that we've launched studies in partnership with research teams, including University of Buffalo, University of Kentucky, and No Kid Hungry, as well as many others, to promote food as medicine initiatives. And this will directly impact and improve the public health outcomes of key populations. So that's been very exciting to see. Next slide, please. In this last example, I'm going to share how we've worked with Instacart is working with the Journal of Healthcare for the poor and underserved to publish a supplemental issue on food access, nutrition security, and health outcomes. I know that there are many prospective students and those who are likely going to be jumping into grad school. So you'll become very familiar with a lot of these public health journals, JHCPU being one of them. And there are sometimes instances where an industry partner or an entity outside of academia could work with the journal to come up with a special issue that focuses on very niche or key topics. And so I had this idea, crazy idea, right, where I was taking a risk, approaching Instacart saying, what if we did this? We haven't done this before, but what if we were to partner with a leading public health academic journal to promote the work that researchers are doing? And so the key lessons from this work stream has been that you can support public health research as an industry partner. I think sometimes, especially for those who are in research, they don't realize that you could still have a foot within research, even though you're in industry. This was an example of exactly that. It might just look a little bit different. The second was in crafting a call for abstracts. So I had the pleasure of leading this work stream for the supplemental issue, working with a number of cross-functional partners to identify what questions do we want to ask and support within this supplemental issue. And finally, what's different from my work now than in other areas has been I don't often get a chance to learn about new research. I'm not reading the public health journals as much as I would like. And so this gave me an opportunity to understand what's new and innovative within this space by being part of this process. And what this impact has been is that we are going to be launching our first ever journal supplemental issue that's sponsored by Instacart. I'm leading this work, and it's a direct tie to public health. So that's been very exciting. Next slide, please. In summary, what's influenced my public health journal, there's really 3 main things. One is being curious and asking questions, going out on a limb and being able to connect with individuals even outside of my discipline to understand what they're doing, but just being very curious about how public health could relate to a business strategy. The second is in translating my work. And I think this is very important, whether you're in public health or not, but being very intentional in stating what is it that you're talking about? Why is it important and what is its impact? And so that is a practice that I'm having to do even on a daily basis, especially in my work in government affairs, where it's very critical to be able to translate my work in a way that could be understood by many different audiences. And lastly is in taking risks. As I had explained with my Journal of Healthcare for Underserved supplemental example, that was a real risk in being able to present an idea and then being able to see it through. On the right, this doesn't include all my influencers, but all the different kinds of key organizations that have been critical in my journey. With having said that, I would love to turn this to Carla Baru, Dr. Carla Baru, who will present a little bit more on her on her career journey next. Thank you.
Great, thank you so much. So I am delighted to be here with you guys today. And I want to start by giving you a little bit of context about where I work. I think I'm flipping through the slides. All right, Nick, I'm going to let you pull up my slide or give me control and we'll go from there. All right, cool. So where do I work? So I work at the South Carolina Department of Health and Environmental Control, where our vision is really healthy people in healthy communities. And so we work to improve the quality of life by really Protecting, promoting the health of the public and the environment. We are one of a few centralized state public health agencies that has combined health and environment. That is scheduled to shift as we move towards July 1st. So we're looking at becoming independent environment and public health agencies. So I'll focus a little bit on the public health side today. And we are a centralized state. And so what that means is all of our county health departments roll up to our state agency. So we have operations in 46 counties with about 3,400 employees at approximately 100 locations across our state. So what does that look like? In an average year, we have over 500,000 clinical client encounters in our local health departments. Over 2,000 healthcare facilities and services are inspected or investigated by our staff, and over 24,000 environmental health complaints investigated, and more than 250,000 birth and death records are filed. And those are just a couple of examples of all the things that our state agency does. I like to say that we cover everything from babies to rabies, and you cannot walk out your door and go through the day without being impacted by DHEC. And you know what it takes to make all that possible? It takes money, people, good processes, and really good administration. And so it's even better when people in administration have a public health background, because it helps us to make our agency better and serve our communities better. So I'll talk a little bit about that today. So my official title is Chief of Staff, which a lot of people don't really know what that means. And honestly, it depends what agency you're at, what a Chief of Staff does. But for me, what that means is I work across all of the teams within our agency. As I said, we have a really wide breadth of what we cover. And so I get to work with folks across all of our program areas, both internally within our agency and then a lot of our partners. But my team is directly responsible for the things that you see on your screen. So I have a team that does continuous quality improvement, data governance and modernization, health equity and inclusion, policy and research, project management, and strategic planning. So many of the teams that I lead focus really on those skills, techniques, or processes that can be applied across all different program areas. So we support everything from diabetes to behavioral health, to immunizations, and just about any other program within our agency. We help to make things more effective and efficient. We help the agency to prioritize our efforts and projects and make sure that we are implementing them on time and on under budget, but more than that, are they really helping us to achieve the goals that we want? And does it link back to that strategic vision that we have of healthy people and healthy communities? I also get to represent my agency and advocating for things like our budget request and projects that will then help our agency to address the social problems that we want to deal with. I collaborate with leadership at other state agencies to really coordinate about how do we improve our services, how are we making sure that we're working together in the most efficient and effective ways. And then things like helping to make sure that both our staff and the individuals that we serve have access to appropriate language services. So those are a couple of examples of sort of what's in my official job description. But my job is a little bit of everything, as I said. So we'll talk a little bit about kind of what does that look like in a day. So there's not really a typical day. So I just picked yesterday, and what you see here is I listed out all of the meetings that were kind of on my Outlook calendar from yesterday. And as you can see, just from the titles of the meetings, it covers a lot of different things. So I went from talking about agency restructuring that I mentioned earlier to prescription monitoring program dashboard to talking about HPV vaccine campaign, to finances and IT systems, to vital records reporting, to potential building moves. Some of those were internal meetings, some of those were with our external partners. But what you don't really see on the calendar itself is some of the other things that I try to do in a day, right? So I like to first start by reading the DHEC press clips. So I like to get an idea of where has our agency been mentioned the day before. One, because I want to make sure they picked up whatever our communications team put out there. Are they getting the message that we want to tell? But then also, hey, where did somebody else mention us that I might want to be aware of before I try to start my day? So I like to read that as a start. And then I also, in my role, have to deal with things that you'll see there in the blue, kind of addressing some HR issues or reviewing and approving purchases or answering emails or that I get and talking to the staff that pop in with questions. And then yesterday kind of ended a little bit with trying to rearrange some meetings due to a legislative request. So we are during that time of year in session where we get lots of requests, and we want to make sure that our agency is responding appropriately and as quickly as we can. And so what I love about my job is that I never get bored. I get to learn about a lot of different topics, and I get to apply my skills and knowledge to really a whole variety of settings. So what does my public health career actually look like? And I tried, as Beatrice did, to kind of distill it into a couple of different things. So for me, what my current public health career looks like is asking the right questions. So a lot of times I get to ask our staff and our partners things about what their projects are and why they're doing them. So helping them to really think through their ideas and figuring out what is the impact of implementing those. And having the ability to pause the conversation and ask them, hey, has anybody actually talked to the people who are going to be impacted by this? Is this something that they want, something they need, or is this really the best way to do this? But it can also be things like, hey, what happens if we implement this? Are we reducing a health disparity, or are we going to be unintentionally creating a bigger disparity because we've made assumptions like everybody has access to the internet, or people can get to a certain clinic location within certain hours? And so I love being able to take the public health lens that I have and apply it to any topic. And sometimes that means I'm the only person in the room who may have an actual public health background. And so if you remembered, I had a meeting yesterday, right, about potential facility moves. So an example is asking the question of, hey, if we do this, what about public transportation? Is there a bus stop nearby? What are going to be the impacts to our clients? And helping folks who may or may not have thought about that on their own, but helping to guide the conversation so that we're really thinking about what our end goal is. And that really takes me to the second point that I think I get to do in this job is really taking things back to the purpose line. So if you think about going back to the starting line, it's really going back to the purpose line, right? It's what is the goal that you would like to achieve? What is the problem you're trying to solve? How are you going to get there? And then how do we link it back to healthy people and healthy communities? So thinking about how do we go back to that purpose? Because if we can't match the work that we're doing to achieving that vision, then maybe we shouldn't be doing it. And so I really encourage our staff, particularly our technical staff, to really think about that. How does everything that our agency does tie back to that? And so I decided to get my master's in public health and in social work because I wanted to improve people's lives, but I was really frustrated by the broken systems that I kept encountering. And so I wanted to learn how to break kind of these ineffective and inefficient systems, which really led to my interest in quality improvement, performance management, and some of the other topics that I mentioned earlier. But at first I wanted to be a part of the system and learn what it was to gain the insights, but also the credibility to be able to help and improve our systems. And so I like to use my role now to influence the system from the inside. So being a part of the system and then trying to slowly fix it and make a difference that way. And now I know I'm not always the only voice at the table, and I can't say that my thoughts always went out, but I do think it makes a difference if you have different perspectives represented at the table, including our public health lens. And I think that the more folks continue to ask the right questions, the better our agency gets, and then hopefully in turn, the better our communities are. And then a large part of my job is fixing problems that people didn't know that we had. So I do a lot of behind the scenes work. And so I try to resolve issues before they can impact the staff or the communities that we work with. And yes, we might still end up with a problem, but oftentimes it might be less of a problem or less of an impact than it started with, because I've tried to work with as many folks as I can behind the scenes to address it and resolve it. And so just like people are anticipating kind of the needs and impacts to their clients and their communities, that's the same thing I do for our staff and for those that we serve. And so I want to just leave you with sort of two final things. One, go check out your local health and state health departments, because I bet they do a lot more than you think they do. And they're a great place for internships, practicums, jobs. And two, don't limit yourself to any specific job titles or programs, right? Public health skills are valuable and needed in all types of jobs across many different organizations. And certainly, as you'll hear from my fellow panelists here, and across all sectors. And so with that, I am excited to let you guys hear from Omar Estrada from the Colorado Department of Education.
Thank you, Dr. Burr. Now, I wanted to give another shout out to our public health people. I'm actually in education, and our school districts are always working with their local public health agencies, especially in a lot of the work that they do with the students. So, shout out to you all for doing all the great work that you do. So, like I mentioned, I'm with the Colorado Department of Education. My name's Omar Estrada. I'm with the School Health Services Program. I've been with the department for a little over 7 years, and I've been with this program for a little over 3 years. But I wanted to share a little bit about my background because it's a little bit not traditional, I guess. I don't have a background in public health. I went to school over at CU Boulder, and I got my degree in finance and political science. So I got a degree in political science because I wanted to work in politics. I thought it was interesting. And that's actually what led me to come here with the department. I got noticed that there was this position open, and I didn't have a particular interest in education, but I wanted to get my foot in the door. And needless to say, I liked it because I only intended to stay for a year. A little over 7.5 years later, I'm still here. So I thoroughly enjoy it. I mean, CDE, the work that we do. It's just kind of a little bit of everything. I think within my first 4 years, I've had 5 different roles managing different programs that usually range in some area of health, usually mental health, but now with this program, it's focused on Medicaid. So it's more generally speaking, a little bit of all kinds of help for students. So that being said, I'm gonna jump forward to the next slide here. So like I mentioned, this program that I'm working with is called the School Health Services Program. I actually transitioned to this role around COVID time. So that caused a lot of shifts, different roles in the department. And they put me into this role because in the past I've worked a lot on program improvement. It's actually one of the passions that I had that kind of kept me along in this program. So this needed kind of an improvement here. We had a lot of issues with our messaging to the districts on how to participate in the program. We had to work on our relationships with, of course, the districts, but also our Medicaid agency. So they put me on here to do a little bit of that program improvement, and I've been enjoying it ever since. So essentially, the School Health Services Program, nationally, it's known as school-based services. It is a Medicaid program, and essentially what it does is it helps districts and Board of Cooperative of Educational Services, which are just like a group of school districts that group together to do some resource sharing. It helps them recover some of the costs of providing services that they're going to have to provide either way, health services in schools to Medicaid enrolled students, and they essentially get reimbursements from doing these things that they're already doing essentially. This is a jointly run program, so I'm with the Colorado Department of Education, and if you look at that diagram on the right-hand side of the screen, we partner with our Department of Healthcare Policy and Financing. In short, we call them HCPF, and with a state vendor as well that helps us with the program a little bit. We work with districts in Colorado, or BOCES, like I mentioned, to essentially put this program together. It's very reliant on good training, making sure that we have good relationships with the districts, and making sure that we just continue the flow of documents so that they can get reimbursed and that they can go ahead and spend it on health services. We, of course, we look at national laws and we get some guidance from the Centers of Medicaid, Medicare Services, or CMS. If you all are familiar with Medicaid, they're pretty big. They can be very complicated. And of course, since we're working with students here, we also have some special education law that we take a look at and some guidance from the U.S. Department of Education. Because Medicaid billing can be so complicated, districts and BOCES do have the option of hiring a billing agent. That's completely up to them. But to my knowledge, I think all except one school district will have a billing agent to help them out with that. So this is kind of the web of relationships that at least when I came on board, we had to work to improve when I was coming in here. It can be a little complicated, and so really my day-to-day will just be very unstructured. It kind of shifts. It's more of a seasonal thing for me. So right now, I would consider this kind of the quiet time for us at the department, and a little bit also for healthcare policy and financing. While we essentially just work on side projects, I have a database that I'm working on for all the data that I work with to essentially get ready for around August time when we start doing our trainings. So we have trainings in August, we have trainings in January. For the most part, you can think of it as, when school's in session, that's when it gets pretty busy for us. So essentially, like I mentioned, this program helps districts get those reimbursement dollars for the services that they provide, and that will in turn provide a funding source for school districts. This tends to be maybe the third or fourth, sometimes a second, largest funding source for school districts. So it is a pretty significant funding source for school districts in Colorado. And what you're seeing on the screen here are the two main funding sources. So we essentially have reimbursements that come from providing those health services. If you look at the legend at the bottom, we have direct health services, transportation, and what's called free care. And on the left-hand side is for Medicaid administrative claiming. So there's two different areas where they get most of their funding sources. You might also get, like there's a true up at the end of the year, depending on how much, funding they need to receive, depending on how much they've already received, that kind of stuff. But for the most part, this is kind of what it looks like. So we'll take 2.5% of all these Medicaid reimbursements, and that essentially funds the work that we do with the districts. Since COVID, we've all been working from home. So again, my day-to-day is essentially emailing districts, working with them to figure out how they're going to get these dollars and spend them on health services for students and for administration. So if you look at the relationship between our Medicaid agency, which is HCPUF, like I mentioned, and the Colorado Department of Education, which is where I'm at, the way I usually state it is HCPUF helps you to generate those dollars, and we help you to spend those dollars. So on the billing side is much more complicated. I would say there's a number of different things you need to have in place. You need to have a good administrative local team at the district level to make sure that, like I mentioned, paperwork is going through, that we're collecting written consents when needed, of course, and making sure, of course, that the services are being done. And that's going to generate the reimbursement dollars that when districts come to me, will work with me to figure out how they're going to spend those reimbursement dollars. And we, of course, track how those dollars are actually spent. So what you're seeing on the screen here are the dollars that are being generated, which, like I mentioned, are pretty significant. So this is more of my side. It's just a very simple slide of what those spending dollars look like on a year-to-year basis. So just across the state, we've had an increase. This is just a 5 years. So, since 27 to 2018, we went from $37 million to $66 million. None of these dollars flow through me. When they come through the Medicaid agency, they'll essentially go straight to the state department, the local school districts. And I essentially just help them to put the parameters in place in terms of, what health services are needed from the community and how exactly they're going to go about spending those dollars. So when they think about how they're going to spend those dollars, they have to work with the local health agency, with the local community, which can include local public health, can include students, parents, local community agencies. I mean, in Colorado, we're a local control state. So essentially that pushes more power, I guess, to the school districts. So I never tell them how to spend their dollars. I essentially tell them, hey, this is sort of the parameters that are in place in terms of what is a health need for students. And these are the rules and regulations in place. And they essentially speak to their local community and figure out a plan of how those dollars are going to be spent. So, like I mentioned, my day-to-day is unstructured. I'll put out the occasional fire, but for the most part, I leave it up to the districts to, figure out what exactly it is they want to do with these dollars, and I'll come in and provide support as needed. I try to do everything I can on the back end to reduce administrative burden. In fact, when I came in, I made a number of changes just to make it a lot easier for them to figure out how they're going to spend the dollars so that they can focus more on the billing side, so that they can try to maximize those reimbursement dollars. And if you look at school-based services for Medicaid, I would say we have one of, if not the best programs, just because of the way it's structured. I mean, school districts can take these dollars and they can essentially, spend them on just a health service, whatever it may be, without too much restriction, I would say. So, that makes me pretty happy to just be part of the program. I've always had a passion just to improve programs. And so, this allows me enough flexibility to figure out what school districts need and, how I can incorporate that in the rest of the internal program management system that I had to build. And, for those of you that have any experience working in public service, public agents, we don't tend to have a lot of money to create these fancy things. So it's a lot of what do I need to learn in order to build something that's going to be useful for school districts, which personally I thoroughly enjoy because we have been able to do some great things. I know the school districts love it, and that makes me happy because that means they can go on, continue to provide services, or they can continue to maximize reimbursements. I mean, every dollar that they spend, or every percent, I guess, increase that they spend is a significant chunk of change going to health services for students. So, it's bittersweet because I'm actually leaving this position at the end of the June. I'm going to go pursue an MBA. But I'm thoroughly surprised at just how, how many different directions you can go in within education. I didn't see myself being in here and doing the kind of work that I was doing, but I've been here for so long because I love it. So with that being said, that's all I got for y'all. So I'm going to go ahead and pass it to Rebecca Rear. Oh, thank you.
Wonderful. Thank you so much. Thanks so much for the opportunity to be with you all today, and for the opportunity to learn from my colleagues in the 40 under 40 cohort with the Beaumont Foundation. So I really appreciate hearing the different perspectives and different career paths we've all taken. And you're gonna hear something completely different from me. So this should be fun. But I did, before I jumped in, wanted to tell you about where I am now at the Maryland League of Conservation Voters and talk a little bit about how I got here. And that is, I've had a pretty linear path. When I was growing up in Baltimore and I was going to high school, there was lead in the pipes and leading up to the water fountains. And so it was apparent from a young age that there are a lot of different aspects of our environment that influence our health. And not just the natural environment, but really in the built environment, and that people build those systems. And so what are the levers of change that we can pull to change systems to improve health and to improve health equity? And I really wanted to do that in the environmental field. Because again, growing up in Baltimore, I was able to see, without yet having terms for it, I saw environmental injustice in practice. I saw housing segregation in practice. And I learned that growing up by observing it. And then it was through my education that I got the sort of formal history and terminology to put to that lived experience. And it helps me value also, both academic expertise, but also lived experience expertise and the value that community brings to informing policy change and those levers that we need to pull. And so I knew that growing up. I knew I wanted to work at the nexus of health and environment, and I wanted to work at the nexus of science and policy. So I did an undergrad in environmental policy, and then I graduated into a recession, which was a super fun time living back at home and taking some unpaid internships. I've seen some questions about that in the Q&A, but I ended up taking some unpaid internships at that time in the Maryland Department of the Environment, having a lot of informational interviews, a lot of coffee with people asking, how did you get to where you are today? So, and that ended up, I'm still very much in touch and good friends and colleagues with people I met at that time in my life. And after that, I decided to pursue a master's in public health. And I did my MPH in environmental health sciences at the University of Maryland in College Park, right outside of DC. And the reason I wanted to do public health, I was debating doing public policy. I figured out early on, definitely not law, because I met with an environmental lawyer and he said, if you want to do environmental law, don't go to law school because you have to learn a lot of other stuff too. And I was like, all right, that sounds good. I'll do. And I decided not to do public policy because I had that experience in my undergraduate and I wanted to do policy, but I wanted to be grounded in the science. And I wanted to talk to people about what they cared about, which is their health. And so I decided to pursue a master's in public health. And then after that, I actually did a fellowship through ASPPH. And I worked for 2 years in the Office of Children's Health Protection at the EPA. And that really kickstarted my career. It was a fabulous experience being able to be at a federal agency, but also kind of have a little bit of freedom as a fellow there. And so the mix of that early on and being able to learn and spend that time at EPA was great. Then I went into advocacy, and that's where I've kind of been ever since. I worked for a while in Maryland at a small nonprofit. And then I worked for a while at an organization called Eco America, where I was the director of their Climate for Health program and engaging health professionals on climate action. And which brings me to where I am now, which is the Maryland League of Conservation Voters. I've been here about 2 years. I'm the director of climate policy and justice. And that I'm the first person to have that role at Maryland LCV, and that's born out of a strategic planning process that the organization went through. So you've heard from a couple of different perspectives. I work at a small nonprofit. I have 12 colleagues, and we, our goal is, our vision is a healthy environment for everyone in Maryland. And we educate and activate people to take equitable and just political actions for clean water, healthy air, and climate resilient communities. And the reason my position was created is because they wanted to really build a climate program, but they wanted to do it in a way that was just. You can mitigate greenhouse gas emissions, and that's good. But if it's not a people-centered program, if it's not people-centered policy, we want to mitigate greenhouse gas emissions in a way that helps people and in a way that improves health. And so climate policy and justice for us go hand in hand. And we're a state level organization, so we work mostly at the state policy level. And so, my other screen over here has the Senate proceedings because we're in the last few days of our legislative session here in Maryland, where we have actually, we've had some offense, but we've had to play a lot of defense on some of the environmental bills we've passed in the last couple of years. So it's been a pretty interesting session. But this event that you see a picture of on the screen is actually, we're doing our annual event. We're doing it again tomorrow. So I'll be able to update this picture pretty soon. But like my colleagues that you've heard from before, it's really hard to define a day in the life. And I kind of like that about my job. There isn't one day. There's definitely a difference in the speed and predictability of things during the legislative session, which is 90 days. In the beginning of the year and then the rest of the year. So during the legislative session, we have a set of legislative priorities that we're advocating for. You see a couple pictures of me testifying and with other advocates and with legislators. We host events for legislators talking about and making sure they prioritize environmental and climate justice. We're really clear about being what it means to be a climate justice voter. And so during the legislative session, I might have meetings on my calendar, but then I learn something and it completely shakes up my day. Or the legislators will announce a voting session in a relevant committee, and I have to completely change my day. Or I think I'm going to be able to leave at a reasonable hour, and then the hearing that I'm testifying on is lasting way longer than I thought. So there's a lot of being nimble and flexibility during the legislative session, and my schedule is not always. But I kind of like that about it, and I like that it's only 90 days. So we do a lot of policy work, and my job is to shepherd legislative priorities through the legislative process during the legislative session. And then I wanted to give an example of one of the bills that we're prioritizing this year, because I think it's important as we, think about the environment and the way that climate change is impacting our health, which is a really important message, and the way that the environment is impacting our health, that we advocate for strong climate and environmental policy that builds health and health equity. Excuse me. And one of the bills we're doing that with this year is a change to our state's energy efficiency program. So everybody on their utility bill pays into this program. It's called Empower. And the Empower program is funding for homeowners to make energy efficiency improvements in their house. And that's really good for indoor air quality, which makes improvements to asthma. It's really good. It actually saves a lot of energy. The cleanest form of energy is energy you don't use. And so having a really strong energy efficiency program in our state is critical to meet our climate goals. And so the program itself needs a few changes so that it can work better for people. It's run differently for low-income homeowners than it is for other homeowners in the state. So making sure we are targeting the needs of low-income homeowners for their energy efficiency upgrades, and making sure we're measuring the program in its effectiveness in reducing greenhouse gases and not just saving energy. And it does a couple other things, but so in any given day, this is a bill that we're working, and that is it's really explicit in our state's climate plan, which is called the Climate Pollution Reduction Plan. And we, as an organization, had comments on that, did a lot of outreach and education on that plan and everything that went into it. It's a lot of the activities that we do outside of session, which is outreach and education, but it results in advocacy on this legislation. The good news is it's moving through the process. It's passed both chambers. And now that it passed both chambers a little bit differently, so it's going back to a conference committee. Hopefully the House and the Senate will work it out. But there's communications, there's infographics, we give webinars on this topic, and we send out action alerts. So there's all these communications and advocacy and engagement tools that we have at our disposal to inform people about this bill and about the bills we're working on. Another campaign that we're launching is 100% clean energy in Maryland. So thinking about offshore wind and thinking about solar and the infrastructure that's needed to build more wind and solar. The other thing, what does it mean for clean energy? What does it mean for the health of the people in Maryland? Turns out, and this may not come as a surprise to you, but clean air is really good for respiratory health. And so making sure that we are finding clean sources of energy for people in Maryland, and making sure that dirty energy does not get subsidies from the state of Maryland. We should not be spending taxpayer money on dirty sources of energy. And right now in the state's what's called renewable portfolio standard, which is the way that we incentivize clean energy sources, trash incineration is included in Maryland's renewable portfolio standard. And what that means is burning trash is considered a renewable energy source. And what it actually does in practice is create a lot of localized pollution. And we see increases in cancer and asthma and lots of other health disparities in communities living near trash incinerators. And there's one in particular in Baltimore. And everyone on this call will understand, the social determinants of health and the cumulative impact. It's not ever just one facility. It's not ever one exposure. And so, but if we can spend state dollars in a smart way when it comes to clean energy, we can also improve health. And that's going to root part of our 100% clean energy campaign as we start to work on that. The other thing I really, it's an exciting part of my job, is to work with the Maryland Public Health Association to launch Maryland Health Professionals for a Healthy Climate. A lot of health professionals learning more about climate change and the impacts to health. And if they're practicing, clinicians or physicians, often they're seeing it in their patients. They're seeing the impacts. We had the first locally acquired case of malaria in 40 years in Maryland. So because, as temperatures increase, vectors have more places to live. And as more rain increases and standing water is there, mosquitoes have more places to breed. And so we're seeing the increases in vector-borne diseases as part of climate change. We're seeing the impacts on the allergy season. I mean, you hear me right now, right? I have there's a lot of pollen in the air and everyone's coming in like, woof, my allergies are really bad. And it's like, yep, that's climate change, you know, and making that connection for folks so that they understand the way that climate action improves health. And so Maryland Health Professionals for a Healthy Climate is still pretty new. And we're really excited to build the health voice on climate action in the state of Maryland. And I'm just going to end, I can't not remind everyone that 2024 is an election year. We're the Maryland League of Conservation Voters, right? So a lot of what we do also is voter education. Just the other day, we hosted a Senate forum. There's a Senate race in Maryland this year in 2024. We had a big governor's race in 2022. So we do a lot of voter education. We hosted a forum where we asked candidates questions about their environmental platforms. And so we have a whole Why I Vote campaign. And so this is, while I didn't necessarily describe one day in my life, I described the various campaigns and strategies and tactics that we're using at Maryland LCV to work towards our vision of a healthy environment for everyone in Maryland. And so 2024 is a big election year. So make sure you're registered, know when your primaries are, so that you can vote in the primaries. And then, Maryland's coming up May 14th. And then get engaged between, your primary and the election in November. It's a really important year. A lot of issues, a lot of public health issues on the ballot, and a lot of environmental issues on the ballot. So appreciate everybody's time. And with that, I'm going to hand it over to Tuka Zokai. Oh, sorry. I forgot. There's one more slide because I figured I'd put a picture of me and the governor and the lieutenant governor in here because it's also pretty cool to work at an organization that is well respected by legislators and the executive branch. And we have a really dynamic team in the executive right now. And having had the honor to meet them and work with them earlier this session. So just putting a plug in there for working at the state level to make change. So, and with that, I am happy to introduce Tuka Zokai.
Thank you, Rebecca. Hello, everyone. My name is Tuka Zokai, and I'm coming from Sacramento, California, so the capital of California. And I'm a senior health policy analyst with the California Dental Association. So this is where I like to say I'm not a dentist. I'm not a dental hygienist. My background has always been in public health. I did my master's in public health at UC Davis. I did a fellowship with Kaiser Permanente Northwest, focusing on medical dental integration. And then I saw someone in the chat asked a question about population health management. So I did my master's in population health management at Johns Hopkins. So I'm excited to dive a little bit into how dentistry and oral health goes beyond the folks we see twice a year. So this is a little bit about the CDA. So the California Dental Association, it is the largest state dental association in the country. And the dental associations tend to represent the dentists of the state. I think many people are familiar with the medical association. So the dental association is similar in that we are there to advocate for oral health policies and work very closely with legislators and decision makers on how to advance oral health and especially decrease barriers for the public. So I work really closely with the State Department of Public Health as a policy analyst. Even today, I'm working on some grants related to increasing access to care with community health centers and dental school partnerships. So a lot of what I do is oral health messaging programs and interprofessionalism. There is no one day that is the same, very similar to a lot of the previous presenters. It's different every day. So I'm going to dive a little bit into some of the things that I've worked on and how that kind of folds into my day-to-day work. So the first is that we are really closely involved with oral health policy at the state level. While we also, while my work is really close, building close connections with local health departments as well across the state. And I know the dental directors at every county in California, which we're lucky enough to have. We also are always advocating to include an oral health perspective in different state policies and to see how we can increase the scope when necessary. So 3 of the bills that I worked on last year, you can see the kind of the dates at the bottom. But the first is, we signed a bill, well, the governor signed a bill to reform dental plans. So here's kind of like your fun fact of the day. The dental insurance isn't really insurance. It's usually a benefit plan. It's a little bit different. So because it works differently, they're also governed by different practices, and some of them may be working against the patient. So we wanted to strengthen dental plan coverage requirements and especially the transparency. So these are the kinds of things where maybe I'm not a lobbyist, so I wasn't the one directly meeting with the governor's teams to be able to move this forward, but I was the one looking into the background information to have a foundation for this to move forward. So a lot of it is gathering the different evidence, looking at different publications, and making a case for why these different bills should move forward. The next has to do with vaccination. So California, we have been looking at dentists as vaccinators for a while, but for some reason there are a lot of challenges, and the one that keeps coming up is refrigeration of the vaccine itself. But there are co-located clinics across the state, really across the country. And so when dental and medicine work together in rural communities and have access to vaccines already, dentists, when appropriately trained, should be able to vaccinate patients as well. So CDA was one of the leading groups to educate, and we led a few different seminars to teach dentists how to vaccinate, to get them that certification and increase their scope of practice. And then, so another piece we worked on that is really near and dear to my heart is we supported the LGBTQIA+ Oral Health Week, and this is something that we helped develop materials for. We worked really closely with another institute, the American Institute of Dental Public Health. So part of my role is a lot of connection building, working with different organizations, seeing what groups are doing and aligning our messaging, especially when, I think public health is used to being like the only public health person in the room. And oral health is often the same. Like oral health is the guy like, hey, look at me, I'm here too. So we try to be in that space. So, being dental public health is even harder sometimes. So it's great to see that different groups are coming together to kind of align their messaging, not just with public health, but with dental public health. And then we share the latest evidence. So while the evidence is being shared to over 27,000 dentists, it really is we have public news stories that are for everyone. So here are a few of the ones that I'm really proud of that we worked on. And I'm going to just highlight this first one, which has to do with Mpox. So when there was the Mpox outbreak in 2022 in the summer, two of the communities that were very highly impacted were San Francisco and Los Angeles in California. And one of the first places that sores would show up would be the mouth. And so individuals were going to their dentist with, new sores on their mouth. They were often painless at first and not sure if it was Mpox or if a cold sore or even something else, like, is this cancerous? And CDA mobilized. We sent messaging to our dentists, the 27,000 dentists, about Mpox, how they can screen, how they can work with their health department to be able to report. We met with our state health department to get more images shared from positive cases from dentists. So we had the first article with confirmed positive case images that were de-identified. And we were able to help our dentists to screen, detect, and help navigate patients because they were often the first line of detection. And when we think about dentists and Mpox, we don't really put that together, but it was a really important time to act quickly. And we learned a lot from COVID-19 on how oral health has a very unique role during infectious disease outbreaks. So I'm really proud of that because we were able to mobilize the state pretty quickly, and Mpox did not get out of control in the way that was originally expected. And a lot of that does go back to the individuals as well, the people who were very serious about quarantining and being safe and trying to stop the spread as well. A few other ones are also on this screen, but I'm not going to dive into them for the sake of time. But I do want to share that we're always looking at evidence and in a lot of health policy analyst roles, not just in CDA, but if you're looking into health policy or population health, a lot of it would be sharing the latest evidence and being very mindful on how to best share it, who is your audience, and what you can do to have a measurable impact in the work that you're doing. So it's a lot of looking into the latest evidence and putting it together for the right audience. And so here's an example. I know a lot of us have been sharing some legislative impacts. So this is just a follow-up from some of the work that, again, I don't do everything alone. Nothing is done alone. So this passed because of a lot of different teams and different people that came together. But California, just at the start of this year, will establish patient protections and transparency because it's now prohibited for dental plans to deny a claim related to a pre-existing condition, and they cannot impose arbitrary waiting periods. So when you get your coverage, you have to wait. Sometimes it would be up to 6 months before your benefits would kick in. So this is something we're very proud of because we saw that this was a barrier for patients and there wasn't a really clear justification for it. So AB 1048 in California has now addressed a very clear barrier. And that's another role of a policy analyst, is to really listen to the community and see what the challenges are, what are the barriers, and how can things change and transform and using that evidence to create a new way of doing things. It is very interesting to see how we can come together and how good data and good synthesis of that data can really transform the way that we navigate policy. And so finally, another thing that I do on my day-to-day is resource development. So here are a couple of the resources that we've developed as part of a larger portfolio of resources, but these are the ones related to COVID-19 and HPV. And a lot of what we're doing here is addressing hesitancy or misinformation and trying to make sure that dentists are also equipped with the information that they need to be successful and confident and share the latest and greatest with their patients. Dentists have been seen to be one of the strongest motivators when it comes to changing some health practices. They're the #1 motivating provider when it comes to quitting smoking and tobacco use, often because of the implications it has on the oral cavity or needing to be smoke-free for certain dental procedures. But they're also a very strong motivator when it comes to tobacco cessation. And so we also can see that with the COVID-19 vaccine and HPV vaccination. So this is Dr. Ryan Thrower in the image, and she was the first dentist to vaccinate against COVID-19. So dentists were first authorized to vaccinate, first in Portland, Oregon, and then it became nationwide during COVID-19. And this can support some of the efforts of the big catch-up that is happening to restore immunization progress. So this is another place where dentists are often not included in the room, and oral health is not included in the room, but we're banging on the door saying, hey, don't forget about us. CDA has supported a lot of different educational campaigns to support dentists as vaccinators and to build confidence and have conversations about vaccines, even if they're not the ones giving the vaccine. Sometimes it's actually impactful for individuals to hear about getting the vaccine from someone who isn't giving it themselves, but is a health professional, because it doesn't seem like, for that individual that they're trying to give the vaccine themselves and trying to push an agenda, but is there for true education and motivation. And to kind of wrap it up, it is Oral Cancer Awareness Month, so it is 4 days in. And something that really stands out to me, that oral pharyngeal cancer is now the most common cancer attributed to HPV in the United States. So as a health policy analyst, this is the kind of statistic that I'm trying to scream from the mountaintops and do some interprofessional collaboration. So I meet with different groups. I meet with those from the American Cancer Society and the California Medical Association to try to make sure that our messaging is concise. A policy initiative that we considered last year was for dentists. One of the things the legislator was considering, but it didn't move forward, was mandatory HPV vaccination in California. That did not move forward, but what did is that we saw that individuals don't want a mandatory vaccine, but are really responsive when health messaging is strong, clear, and comes from multiple sources. So we are really trying to support our dental community, dentists, dental hygienists, in knowing the latest information about HPV and how they can talk about it. So you can see an example of one of the resources we just published. So I say all this to say health policy analysts have a lot of different things that they do, and it's different at every organization. I'm very passionate about oral health because I just think, if you're here in the room and you're interested in public health, you're used to really caring about something, but often being left out of the room or not getting the right support or funding. That's just a public health truth. But it's also a very mighty and passionate field. And when, for me, bringing the oral health and public health together has just made me meet so many wonderful people. I've had a lot of support, and I'm very thankful for Beaumont for giving oral health a platform amongst like such incredible leaders. And with that, we'll go to Q&A.
Thank you all so much. We can actually, there's tons of questions and we will try to get to all of them. If all of our panelists want to come on to the screen, and we can actually stop sharing, because I always like to be able to see our faces of everybody. And we're going to ask some questions. If for some reason your question doesn't get answered, you can email students@aspph.org. We'll put it in the chat and we'll follow up with you to get your question answered. So we're going to try to ask some general questions, but one thing I forgot to mention is everyone here on this panel is part of the 40 under 40 to Beaumont Foundation group. So congratulations to all of you on being honorees of that prestigious program. And also it's National Public Health Week. So we really appreciate the diverse group of people from all different platforms of public health talking about all of the work that you can do in the field. Our organization does the This is Public Health brand, and it's always hard to explain to people all the things you can do in public health. It's everywhere, everything everywhere all at once. So my first question to start off is, for people who aren't studying public health, how do you describe it to them, the work that you do? And I'm sure when you were going to get your degree, you were like, your family would be like, so what's this public health thing? So does anyone have any tips on explaining it to people who aren't studying the field?
Yeah, I can jump in. There's two things I like to tell people. One is like, take a deep breath. Wasn't that nice? You know, like clean air is it's because there's laws to protect clean air, and it takes a lot of work to enforce those laws and make sure. But what we have is a system where right now some people have cleaner air than other people. And when it comes to public health, we need to make sure everyone has access to clean air and clean water. And clean water has become a huge issue in recent years. And so access to sanitation, and so there's a lot of access. But I just tell people, I do this all the time. I just tell people, take a deep breath. And like, that didn't happen by accident. It takes a lot of work to make sure that you can take a deep breath. And I think that was especially meaningful during the COVID-19 pandemic, when we understood how something that spread so quickly, how it affected people who were vulnerable and already had respiratory illness, and what it meant for people living near polluting facilities. And so I think that take a deep breath moment, people get it, right? And the other thing I tell people is, we got to celebrate all the things that don't happen every day, because there is a public health infrastructure in place that makes sure there's a lot of stuff that doesn't happen. And when we hear about public health, it's because some disaster, some terrible thing happened. And that's when the public health system has failed, when something bad happens. But every single day, you stop at a red light, you put your seatbelt on, you put a coat on when it's cold, you put sunscreen on. You should every day, but usually when it's sunny, right? And those are all, that's because of public health campaigns, public health education. And there are these things that we do every day as part of public health. We turn on our taps. Some of us can turn on our taps and drink healthy water, right? That takes a lot of work. And because public health works so hard to make sure things don't happen, we're often first on the chopping block for budget cuts, because they're like, oh, great, nothing happened, we can cut that budget. It's like, no, man, nothing happened. Increase the budget. And so I think celebrating the things that don't happen is a little harder to message. And yet it's a key part of public health. So deep breaths and think about all the things that did not happen that made you a healthy person today.
Thank you so much, Rebecca. Tuka, I saw that you raised your hand. Did you have anything to add?
Yeah, so the first thing that stuck out to me when I wasn't in public health yet was the river metaphor. So I was in my first public health class. I was kind of a pre-health student at the time. And we were told this metaphor that many of you may have heard, but there's someone walking by a river and they see individuals in the water, and there's people pulling folks out of the water. And they say those are the medical professionals, those are the people helping those that are already in the water. And then you go upstream and you see that there's a bridge that is broken and people keep falling through the bridge. And the folks that look at the bridge, fix the bridge, that's public health. So it's that kind of behind the scenes infrastructure that helps support healthy living.
I love that. All right, so our next question is kind of pivoting a little bit, but for those of you who work, I know, Omar, you said you're going to go get your MBA, and some of you work for-profit businesses. Is how do you incorporate public health work in for-profit businesses as opposed to, nonprofit work that is maybe more public health driven, but how do you incorporate it in for-profit business? Anybody have any tips on making it part of the agenda?
I'm happy to jump in. I'm still like reflecting on Rebecca's response, just how powerful that was. But a thought that I had when I first joined Instacart immediately made the connection of if you have access to online grocery, it could be a real game changer if you're in a community where maybe you may not have food access. And I remember during my interview, I'm located in the DC area, and in parts of DC, unfortunately, many people experience still lack of proper food access. And so going through the neighborhoods and identifying some addresses, I put within the app on my phone an address in a community that is considered low income, low access, and saw that it enabled access to some phenomenal grocery stores within the area. And so one idea was, how can we understand our coverage as a company at Instacart as it relates to people who are experiencing food insecurity or who live in low income, low access areas? And so I think asking a question, can be a way of directly influencing and bringing in a public health idea into your work, whatever workspace you may be in. That was at Instacart. Previously, I was at Ipsos, a major polling firm, and we did a lot of government contracts with the Defense Health Agency looking at patient experience outcomes. And so even in that situation, it was asking a simple question as, when a patient is engaging with their provider, does that lead to better adherence when it comes to diabetes medication? Can we access your data to look at that? And so that was another opportunity to ask a question, bringing in that public health lens of, how do you fix a problem, or how do you better understand an issue, and bring that to your leadership and your colleagues.
Thank you so much. Carla?
So I know your question asked about private industry, but I wanted to add to it because sometimes other state agencies don't think that they're public health, and I would consider them public health, right? So I think broaden your question. It's not just selling it to private, it's how do you integrate public health into everything? Because honestly, I could make the case that anything we do is public health, right? And I think it's being able to tell that message and sell it. So I think a really good example is, I'm a commissioner on our board of housing. A lot of people say, why does public health have a seat on the commissioners for housing? Well, the reality is, if you don't have access to safe and quality housing, your health is going to be impacted, right? If you don't have a place to go. And so we see that connection in our world, and it's just telling that story. I think Rebecca did a great job of that, right? Helping to tell the story in a way that everybody understands. Well, if somebody doesn't have enough money to pay their rent, if they're trying to decide between rent and healthcare, right, it might be rent. So if I can help influence what that space looks like, even though it's not public health, right, it really helps all of us to get to a better place as community. And so I think it's being really intentional. How do we integrate it, again, into any industry, and whether it's private, for-profit, nonprofit, government, and how do we really just make public health kind of a seamless thing where everybody's talking about it, whether they know it or not.
Absolutely. Omar?
Yep, I would absolutely agree with what you said, Carla. Being in education in a state agency, it's very frustrating at times. And I think it might be because, I mean, in Colorado, the Department of Education is unique in that we report to a board that's elected. Every other agency reports to the governor, including, of course, our public health agencies. And so maybe, because they are the public health agency, they see, oh, we get everything from them, where really it's more of a harmony of just we work with Medicaid reimbursements, but there's still health services being provided in schools. There's still messaging on health services being provided in schools. And oftentimes we don't get those from the public health agency. You know, we get them from like a number of different sources, national agencies and all that. So there's maybe a need to remind everyone that there's, you know, a harmony in place. A student, you know, I would say this all the time when I talk to parents, you know, your student cannot physically, you know, focus or think if they aren't, you know, getting food that they need, if they don't have access to good, healthy food, if they don't have access to basic need or safety, they literally can't. And for me, it was a rather new idea, not having a public background, but it was when I worked with organization called the Child Trauma Academy. They're a fantastic group, but you know, you can really see how it just kind of, you know, shuts down, and then parents can finally see that spark and go like, oh my gosh, you know, it's not because they're a terrible student or they're just not paying attention. It's because they may not be able to physically sit down, pay attention because they're hungry, because they're X, Y, and Z. So, you know, the need to remind everyone that there's kind of a harmony that needs to be achieved, I guess.
Thank you. And it also, I mean, we don't have to go down this rabbit hole, but it depends also where you live and how much you have to defend public health. And that's a shame. And hopefully we get to a place where people understand what you said, Rebecca, that it's all of those things that keep us safe. So my next question is we got a lot of questions about jobs and how to network. And a few of you talked about informational interviews. And I think that people say that a lot, but I'm wondering, what does that look like? And what sort of questions should you ask? And how does that whole process of reaching out to a complete stranger on LinkedIn look like for somebody who's just intimidated, but wants an opportunity to see what's out there and potentially start networking? So does anyone have any tips on informational interviews or successful networking?
I can jump in. So a lot of what I did originally was just reach out to individuals that were doing work that was really exciting. I sent either a professional email or found them on LinkedIn and messaged them through LinkedIn, and shared, you know, what I admire about their work or their journey, be it like their schooling or what they're working on or a publication. So highlighting their work and then asking if we can talk more. Also, a thing with public health in a lot of industries is if you're interested in someone's like paper or research and you send them an email, usually they'll respond. Like they're excited, individuals are engaging with their work, and it feels really impactful. So that's another piece. If you're like, you don't know where to start, maybe if there's like something that really stood out to you in a publication, you can reach out to one of the authors. And include a little bit about yourself. You don't need to include your whole CV right away and your whole resume, you know, just say like what you want to talk about and what you're interested about learning. And usually ask for maybe 15 minutes to begin. So not a huge chunk of time, just to kind of first building that relationship. I also really recommend, if you're able to go to different conferences. I did a lot of my dental public health networking at the American Public Health Association meeting. And I've gone very involved with the leadership there as well within APHA. So if you haven't been participating in that space yet, I highly recommend it. It's a really amazing place to network, and there's people all over the spectrum of their professional journey involved in that organization.
Great tips. Thanks. Omar?
No, I didn't have too much extra to add. I just wanted to, since I'm going to grad school, I'm getting ready to go on the job hunt again. I just had a quick recommendation, a book called the 2-Hour Job Search, that, you know, is just systematizing, you know, looking for that job. I don't know if it'll take 2 hours. Maybe that's just the title of the book. But, you know, if you have a LinkedIn, if you have a network of some kind, you know, it's just a good way to really branch out and hash out exactly what you want to do, and, you know, what sort of organizations you can work with to do that good work that you want to do.
Thank you. Carla?
The other thing I tell students, so I have some practicum and intern students that work on my team, is I tell them, when you're a student, you can go ask anybody anything you want, right? It's a lot different if I go ask somebody something because they're thinking like, oh, what does Carla want? Like there's an alternative. If you just say, I'm a student and I'm interested, you can ask anybody almost anything, and you should play that card as much as you can while you can, right? I mean, I think it's a great learning opportunity. And I'm also usually more willing to answer a question from a student, right? Because again, I think they don't have a motive, right? I'm just thinking they just want to know. So I think it works both ways. So definitely leverage that. And I think I kind of will echo this sentiment. I think people in public health in this field are just more likely to answer questions, right? Part of it is I think we want to spread the news about the work that we do. Again, whether you're in private industry or nonprofit, I want everybody to know what we do. And so we're happy to talk about it. And then I think it's also about how do we build the future workforce, right? I know that there is a crisis right now in public health workforce. That was one of the questions, right? I can't always be competitive in my salaries, but maybe if I'm nice to you now and I answer your questions, I can help kind of leverage that in the future. Like, hey, I've really sold you on our mission. And so I think there's just that wanting to build the pipeline and really celebrate what public health is. So again, you and your students, ask all the questions that you can.
Great advice. Beatrice?
Yes, to add to what has been shared, I think one thing that's been very helpful for me is being intentional in my ask. So whenever you're reaching out, if there's some obvious things that you can Google or you have an idea of what it is that you'd like to discuss, a way to stand out is being very clear and specific on what you want to gain from the meeting. Because oftentimes people will be approached, to do an informational interview or, hey, very generic kind of questions. And so you want to stand out from being a generic question saying, look, I'm requesting 15 minutes of your time to specifically ask about X. I can't think of an example right now, but, but have an example in mind, whenever you're reaching out. So then it's very clear from the other side what it is that you'd like to be able to gain and accomplish within the meeting. That's my input.
Yeah, and just to add to that, the intentionality, your last question on an informational interview should always be, who else should I talk to? And can you connect me? Because the person you're talking to also has a network. This just happened. A legislator emailed me that an intern in another legislator's office was talking to him, and he said, and he's interested in environment and health. Hey, I know someone. And, do you mind? And I was like, sure, yeah, no problem. And we're getting coffee on Monday. So I think always finish your informational interview with an ask to be connected to somebody else in that network. And I think just tap into your, if you've finished undergrad, like tap into your undergrad network. I get a lot of emails from the, I forget the acronym, it's OSPAGOD, but it's like the Office of Student, it's like, postgraduate life, right? And I get a lot of emails from my undergrad saying, hey, I'm writing to connect you with this student who's interested in going into a career field similar to yours. Can you talk to them? Absolutely. So I think that's right. I think Carla, you once said it, like, we don't really say no. It might be like, how's next month? But it's not no, right? So I think don't shy away from making the ask, and tap into your if you like undergrad network, graduate school network, and because there's a lot of campuses have that office that's a lot of times underutilized, and so tap into that network, and also end with asking to be connected to others.
Thank you all. We're going to have time for one more question. What is the coolest thing that you have done in the field of public health? It doesn't have to be in this current job that you have, but what is the coolest thing that you've done working in the field? And it can be your definition of cool.
I'll jump in. I'm going to go back to my dissertation. I never imagined my life that I would be studying migration in Indonesia. And I think the coolest experience was when I was invited by the University of Indonesia to lecture on my findings. And I was almost in tears, kind of standing on stage, just sweating also because, oh my gosh, Jakarta is very hot. But, it was a real full circle moment for me as an immigrant myself. I immigrated from Kenya to the United States and got a chance to delve deeper into that work in my my PhD studies. It just was one of the coolest experiences. So I would say that one takes the cake for me.
Anybody else? Oh, Tuka?
I was just saying, pictures, that's really cool.
Yeah, it does. It sounds amazing.
And yeah, I think a lot of it has been like these moments of awe within the field. Kind of with as my career progresses, I've had so many moments where I'm like, this is my dream job. And then seeing that there's something new that comes up. So I'd say I've learned not to limit myself or limit my thinking while in public health, because I feel like we can often have a scarcity mindset. And with public health, you don't often see the results of the work that you do. You know, it's at much more of a distance than if you're a one-on-one kind of provider. But then when you do see the impact of your work at kind of that 10,000 foot level, and you're in these spaces making these big plans for entire populations, it gives you a lot of awe. It gives a lot of pause to know, like, wow, the kinds of things that I'm bringing up can have a lot of impact and influence. And just taking that kind of privilege really really to heart, and cherishing like the opportunity to even be able to be in having those kinds of platforms. Like even this call right now, like I just think it's so cool that there's so many people that took time on a Thursday to come and learn about what we do. Like that alone is just like, thanks everyone who's listening, because it's really cool.
I think agreed with, you know, unforeseen opportunities to present, I think are really cool. Not limiting yourself is really cool. I also, for me, it's been these like creating aha moments for people. That's been really cool. Like to just, when I am talking to someone and I see them make the connection between the environment and their health. And it's someone who hasn't really thought about it before. And I've been lucky enough to see that a few times, and it mostly happens in that one-on-one conversation, and connecting with people. And but for me, the thing that's been really cool in public health is creating those aha moments, because it gives me hope and optimism that I just recruited a new person in public health. And so I think that's the way I'll answer the question, at least for today.
All right. I know that we're running out of time. Omar, Carla, do you have anything to add?
I'll keep mine short. I submitted a grant when I was managing one of the Project Aware grants. So it was for another thing of funding. Never done a federal application before, so coming in very new, absolutely terrified. We were able to get awarded though, which was awesome. Best feeling in the world, because that's, you know, I think it was for $9 million going back to schools. The best part about it was the person we hired ended up submitting another grant, and they ended up getting awarded again, which is amazing, because you know, I knew the work that was being done with that grant made me feel good, so it was awesome.
So one thing I'll just add is, I think for me it was I saw an issue when I was Peace Corps volunteer, and I went to school and I went back and I got a Fulbright grant to go research what around public health and social work. So I think, and being able to apply that research. And so I think it's the opportunities to leverage like your academia and your practical experiences, and then seeing all of that come together has been really cool for me. And so I think the last thing I want to say to you guys is really, don't be afraid to take like an unusual career path, right? I mean, did a Fulbright in the middle while I was doing my MPH, right? And so I think figuring out how do you put those things together, and most institutions are willing to work with you, right? So figuring out how do you put all those things together to really do something cool that you want to do and that you think is meaningful.
Thank you all so much. And this was incredible opportunity to just talk with all of you and to hear your stories. And we really appreciate you sharing your stories with all of us. And thank you for all of you who attended today. There's a link in the chat of where you can get the recording. We'll be posting it soon. And if there's anything that you weren't able to get answered, again, please email students@aspph.org. But thank you to all of our panelists today. Thank you to the Beaumont Foundation for partnering with us on this. And we look forward for more of these sharing of stories and talking about the field. So thanks again, everyone, and be well. Take care.
Thank you.
Thanks, everyone.